Hi, everybody. It's Dr. Tenenbaum with West County Plastic Surgeons of Washington University. And I'm coming on today to just quickly talk about breast lifts. Breast lift is an extremely common procedure and it can or cannot be combined with breast implants. So let's talk about that. A breast lift is for a woman who is interested in kind of changing the shape or position of her breasts on the chest. Um, it's actually quite similar to a breast reduction as well. So, with breast reduction and with breast lifting, often the procedures are somewhat similar, but it's a spectrum of how much tissue we're removing or how much volume we're removing. Obviously, with a breast reduction, we're removing a lot more volume, but we are always still repositioning and reshaping that tissue to get a breast lift as well. So, we always say that a breast reduction usually comes with a breast lift. So if you're a candidate for breast reduction or wish to have your breasts smaller, that is also kind of a component of it as a breast lift. For women who are interested in maybe a similar volume to what they currently have, maybe a little bit smaller volume than what they have, a breast lift alone is often a great option. So both of these procedures come with a trade for some scars that can be visible on the breast. So typically with a breast lift or a breast reduction, the scar is going to go all the way around the areola, and that can be resized. So often we're making that a bit smaller to match kind of a smaller or more lifted breast. And then it often also involves a scar that goes from about 6 o'clock on the areola down to the base of the breast. So that we call the vertical component of the scar. Sometimes, depending on the amount of tissue or the amount of excess skin, you may require some degree of a scar in the crease of your breast, ranging anywhere from just a small extension in the crease all the way to the full extent of the crease, which is called a Wise pattern. And so kind of the length or the type of scar that you may require is really just a conversation with your board certified plastic surgeon. They can kind of counsel you on what they feel is going to give you the best result. And a lot of it has to do with sort of your anatomy and your goals. And again, using these scars and these techniques, we can do several things. We can resize the areola. We can resize the breast. We can reposition the breast tissue higher on the chest wall, and we can reconfigure some of that tissue to a prettier shape or reshape the breast. Now, what if you want those things, but you also think you want some additional volume, or you want a lot more fullness in the upper part of the breast, or what we call the upper pole? So there are some options for you as well, depending on the quality of your tissue and where we're starting. Sometimes we can get a lot of increased upper pole fullness just with rearranging your existing tissue. Sometimes we can do liposuction of another area, and then we can inject fat into the upper part of the breast to help improve the shape and the fullness in the upper part of the breast. And sometimes we may talk about adding an actual breast implant to the breast lift. And again, kind of what's best for you is going to be based on your goals and also based on what your plastic surgeon thinks might be best for you. And so when I'm thinking about this and I'm having a conversation with one of my patients, I'm thinking about her goals. I'm also looking at her tissues and kind of evaluating the quality of the tissue, the quality of the skin, and I'm going to recommend what I think might be best. In general, if somebody wants a very round, full look in the upper part of the breast, and breast implant may be the only way to really accomplish that. If they have pretty good tissue quality, but want a bit more fullness and want it to look more natural, then injecting some fat in the upper part of the breast really may do the trick. And other times I may think, you know what, we're going to get a beautiful, nice full look with just rearranging your own tissue. So again, it's really individualized and customized to the individual patient. It's not one size fits all. And so the best thing to do is to meet with me or another board certified plastic surgeon that does a lot of breast procedures and be evaluated and have a really honest discussion about your goals. So somebody's asking, what about just liposuction? That's a really good question. So Liposuction is a technique that is used to decrease fat in a particular area. We suction fat out and contour a particular area. So sometimes we do use liposuction in the breast. It's actually quite common to use liposuction around the borders of the breast, so like the axillary fat or the lateral chest fat. Liposuction of the actual breast can be done, but I would say it's far less predictable because actual breast tissue is not going to suction out of the breast very well. Fat will suction out better, and so sort of how the tissue of that particular patient is can kind of be a determining factor in whether or not liposuction is going to reduce the size of your breasts enough. Liposuction alone to the breast isn't really going to do a heck of a lot to reshape the breast. Really, it's just going to decrease bulk or decrease volume in the breast. So it's not great for somebody who really needs a lift, has excess skin, doesn't like the shape. We really have far more control over the shape and position and any excess skin if we can remove skin and reposition tissue through using breast lift. But that was a great question. Liposuction alone is actually pretty rare to the breast, but can be used kind of in conjunction with some other procedures. Recovery time is another common question that we got. So the procedure itself can be done in the operating room. You are asleep under anesthesia, but generally you can go home the same day, so an outpatient procedure. Usually we don't need any drain tubes, although that is going to be individualized based on your surgeon and their preferences, but usually these procedures can be done without drain tubes. Typically the wounds will heal up within a couple of weeks, but you still have a couple of weeks of kind of overall healing of the breast itself. So my instructions generally are no strenuous activity or heavy lifting for usually around 3 to 4 weeks, and depending on kind of what we do, sometimes it can be a little longer. In the meantime, you can do light, easy walking. You can usually do normal daily activities. Usually you can drive within a few days, but no strenuous activity or exercise for more like a month. And your surgeon will kind of release you to those activities depending on your healing. Okay, hope I answered your questions. If you have more questions, go ahead and leave them in comments or send me a message and I would be happy to answer them. Thank you so much for tuning in, and I will see you next time. Also, I'm always happy to take suggestions for more topics. Thanks, everybody. Have a great day.